How is the coronavirus affecting pregnant women and mothers of newborns?
The amazing thing with this coronavirus is that mothers are not at increased risk. During pregnancy, you're not at increased risk from coronavirus. And amazingly, there doesn't seem to be infection that's passed on to the baby via the placenta. And so, there are a number of cases of mothers getting coronavirus during pregnancy and needing to have be monitored and those kind of things, and no harms to the baby. And mothers often can do very well sort of during this. So I think the important point, Alejandro, is that mothers are not at an increased risk. When you have a look at the figures of who gets affected and who ends up in ICU, it's not babies, it's not young children. So I have a lot of mothers also who have young families who are very worried about the impacts of this, it's not an increased time of risk. And so I think what I'm sort of seeing with my practice is a lot of mothers, mothers care incredibly about everything, including their families. And pregnancy brings up so many things anyway in terms of vulnerabilities and what have you. And so I think just this the pandemic has brought up so much on so many levels for many people, and during a pregnancy, the things that I'm seeing very often come up are not only about, am I going to be okay in my family, but also what about the hospital? I need to go to the hospital. Is the hospital a safe place? And we know one of the most important things for a pregnant mother and a mother early on with a child is a sense of safety. And so, I think it's really important to try to support that as much as possible. I'm not too sure what the situation is in the United States, but in Australia, if you're birthing in the hospital, you're only allowed to have one person in the birth room with you, which is really tough, especially if you're expecting a bigger team. You want to, perhaps your partner and a doula and other friends and support people there. To be restricted to one person, that brings up a lot of angst and anxiety, I think. And so, but to come back to your question in terms of risk, it's mothers are not at increased risk. There was some question about, does COVID-19, if a mother gets it, lead to maybe a premature delivery? But the research actually shows it's more, it causes induction of labor because the doctors are worried about delivering the baby before the mother gets sicker. And so it doesn't actually seem to cause that. So the risks are very low. With breastfeeding, the virus does not pass into the breast milk, and that's quite clear. So, I think that's something really important to, and breastfeeding is actually really important for the baby.
But if a mom has corona and is breastfeeding the baby, it's going to go through the airways. It doesn't necessarily need to go through the breast milk.
No, but this is where you can perhaps pump the breast milk and then use that so that's what's been sort of happening in the hospital system. Is often the breast milk doesn't have to be thrown away, essentially, and it can be used for the baby. Just obviously the contact between the mother and the child, the mother's going to have to isolate for 2 weeks to then sort of recover, which again is a very extremely hard situation for a new mother. But the actual breast milk doesn't contain virus.